Good afternoon, everyone. I'm Charles Muswhite. I'm delighted to welcome you all to this webinar. I'm the co-director along with Professor Andrea Tales of the Centre for Ageing and Dementia Research. So welcome to the webinar. We're part of a group of projects that are funded by Healthcare Research Wales, all looking at different elements of trying to improve people's health and well-being in Wales. We're known as CADR, but we're actually called the Centre for Ageing and Dementia Research. We try to bring together people with expertise in ageing across the whole of Wales, from those in academia, with those in policy and practice, really with the overall aim to make Wales the place to age well in, make it the place that we all want to live our lives out in. As part of our remit, we deliver lots of seminars like this one. At the moment they're webinars, of course, while we're still online for now, which gives us the chance to reach a little bit further, but the disadvantage that we can't all meet each other in person and have discussions about the topic like we used to be able to do. But hopefully as things ease up and things improve, we can only look ahead to perhaps doing some more in-person seminars, but also linking those with some webinars in the future. I think that might be our plan over the next year or so as we go. We cover all different aspects in our webinars, from biological to social to psychological elements of aging, and try and bring those together and apply them to real life issues. Like today, for example, we're applying those kind of theoretical background knowledge to look at transport. So I'm delighted to be able to present one of my own areas of interest today, transport in later life, along with Sarah Jones from Public Health Wales. So I'm going to start the presentation in a minute. Please do put any questions in the chat box or in the question and answer element of Zoom there, and we'll try and answer those as we go along, perhaps at the end. So I'll make a start, and then Sarah will join us and concentrate on a couple of bits that I introduced earlier on in my presentation as we go. This is all being recorded so that you can enjoy it again in your own time, and perhaps the people who weren't able to attend can also be have a good watch and a good view of it. And you know, do send any questions or queries if you can't manage to do them today, or colleagues can't do them while we were live, to me there on my email. You'll see there that my email address has changed compared to what it was, because I'm moving universities to Aberystwyth University and I have an email already set up there. But you won't be getting rid of me that easily, because I am continuing in my role as co-director of the Centre for Ageing and Dementia Research, albeit just from a different institution. So just to remind you as well, at the end of all of this, just please do fill in the evaluation form about the webinar, because that really helps us in planning our future webinars and work out where to pitch these. You know, they're open and free to everyone, so we try and make them accessible to all people. But, you know, what kind of topics do you want to see? Let us know. What works well, what doesn't work so well. You know, we're always open to suggestions, so do let us know. So without further ado, I'll begin the presentation. I should have control of the screen. There we are. So I'm going to go through why mobility is important to us all as we age, and then I want to draw out the elements, perhaps what we might call intersections of mobility, health and aging. That in terms of mobility and transport, we can't think of it really in isolation to the effects it has on us in health and well-being, both positive and negatively. You know, we've seen a huge increase. I think it's something like a 2000% increase in private vehicles use in the UK since the end of World War II, roundabout. About 70% of trips we make in the UK now are by car, and we drive about 356.5 or so billion miles in total a year in a private vehicle. So the car has brought us huge pleasure. It's brought us huge access to jobs, to connecting to family and friends, to worlds and countrysides that we wouldn't have had access to before the war, perhaps. It gives us opportunities to access cheaper goods and services, But that's all very well and good if we can afford a car or we're able to drive. It comes at an enormous cost to society, a cost that's a burden to us all, a cost that probably falls more heavily on certain groups of people than it does on others, making some groups at a huge disadvantage while other groups take the advantage of it all. And particularly, like I said, those who probably don't drive or certainly don't drive very much are at a huge disadvantage, because we've concentrated a lot on the benefits of the car without looking at the disbenefits. And health is no different to that. Health is something that is an external outcome of mobility, and it can have negative consequences. And in particular, we like to concentrate on those 4 elements of where mobility and health join together. So road traffic casualties and injuries, pollution, and the 2 I'm going to concentrate on in my presentation, in particular, community severance and reduction in active travel. And they have health implications as a result of how we are mobile in our society together. But it's not all doom and gloom, because I will look at how we improve things in terms of recommendations before moving on to Sarah's presentation, who I think concentrating a little bit more on some aspects of that, the 20 mile an hour, or the potential to have 20 miles an hour as an intervention in public health, and the problems that are associated with speeding vehicles and how that impacts on us all as we age, and also looking ahead to some of the future mobilities and driverless cars. So, probably not surprising to us all, but it needs to be said so everybody remembers, the desire to get out and about as we age doesn't diminish as we get older. We still want to get out and about and do things. We might not be working so much or working at all, but we still have lots of activities that we want to connect to. And because we live in what we call a hypermobile society, where we're living further away from the things and the people that we want to connect to, we're more likely to be mobile and need to move between different places in order to fulfill what we want to do. It doesn't matter how we're doing that, but we want to stay connected to the people that we've met in our lifetimes, our family and friends that we might have moved away from over time, as well as getting involved in voluntary activities, maybe part-time work, maybe full-time work still in later life, but also really importantly, leisure pursuits and enjoying ourselves and having fun. We've got an increasing number of people living later on in life who are perhaps more fit and more well than previous generations, so they're more likely to be mobile. The data suggests they're more likely to drive. That huge increase in cars sees their way through to later life as well. So although you reduce the number of journeys and the amount of miles that you do in later life, you're also more likely than previous generations to be mobile, and in particular to be mobile by driving a car. And that has health implications, as we'll go into. Mobility is really important for people's health and well-being. And we know that that's linked, a reduction in mobility is linked to a decrease in well-being, an increase in depression-related health problems, stress, isolation, mortality, and things like that. And particularly giving up driving is related to these elements, often referred to a major life event. We want to know why that is. Why are we so wedded to our private vehicles, to our cars, that make it really difficult to look beyond that in later life? I wanted to just emphasize, first of all, in some of the research I've done before, that I think sometimes we underestimate the power of mobility. We think it's just about getting from A to B, and of course it is. That's really important to fulfill the things that I said earlier. We want to visit the shops, we want to be able to do our banking, we want to be able to access healthcare, we want to be able to see our friends and family, but it's also more than that. And a model I drew up a decade or so ago, along with Heber Haddad, emphasized that. When I worked with older people and I asked them what was important to them about mobility in later life, they talked about, first of all, that bottom level of need. We placed them around a hierarchy where they're all equally important, but that bottom level of need came out more strongly and initially. And that is the need to get from A to B, as we were saying, in a safe, cheap, reliable, comfortable manner. But as I worked more closely with older people and we kept diaries over what journeys people were making in later life, worked in focus groups and workshops about how these elements were important or not to people, we had a look also that what came across was that people very much felt that mobility gave them that independence. It gave them a status, a role, an identity, particularly within families. People were able to say, you know, I can look after the grandchildren. It still makes me feel that I'm helping out. I feel that I'm able to be independent and go to places when and where I want to be able to. Very much seen as normal in society. You know, reducing your mobility and staying at home was difficult to do because it's not what people do, as we've all found, you know, during lockdowns and the pandemic. The need to get out and about and see the world moving around is really important. And that's where the top level of need came in as well. That's more like mobility for its own sake. So mobility where you feel the mobility yourself, particularly people enjoying, you know, walking and feeling the wind on their faces, being able to walk up and down hills, feeling their body change within all of those elements. Really miss that if they can't do that anymore. Being able to just see beautiful surroundings around themselves. So whether you tie that into one of those A to B journeys at the bottom level of need, so you might be visiting a healthcare appointment, and then taking a long journey home to unwind from that by driving through the forest, or visiting friends and family on the way back and going to the seaside. We had people doing, for example. So mobility fulfills what you might call immersive mobility. And then we had people who didn't get out and about very much at all, and perhaps a level of imaginative mobility. So still wanted to be around movement that's happening, even if they weren't able to do so. So watching and observing other people's movement, talking about stories of travel and transport from the past that they've been involved with, but not necessarily always do it themselves. So that was just interesting, that mobility fulfills a lot of different needs, a lot more than perhaps planners and policymakers take into account, because often the solutions are around that bottom level of need. Just to emphasize the importance of that tertiary mobility, that top level of need. I think very much we often think about mobility as something, particularly for older people, just to get them to healthcare, just to get them to the shops, very practical orientated. But of course, older people, you know, are and why shouldn't they be, the same as any of us, are more multi-dimensional. That, you know, they want to go to pubs, to leisure, to sit in a coffee shop and see the view around. Some people talked about the way that happens on vehicles themselves. You know, they become what we call third spaces. People enjoy going to the shops, they're fun. People like to sit on a bus and chat to other people, for example. Lots of different other elements that happen in mobility that are kind of taken for granted or not emphasized very much. And then when people give up driving, it's all three levels of those needs that are affected for older people. So it's not just about not being able to fulfill the practical and utilitarian journeys from A to B. It's also about losing something about your identity and your independence and your feeling of normality, and also not being able to go for journeys just to see nature, to see the world going on around people. You know, there's and I'll come on to this in a minute, there's potential for being able to ask other people to fulfill that top level of need. Can you take me to the beach? Can you take me to the forest? That kind of thing. But older people felt reluctant to do that and ask other people to help them do that, because it was seen as perhaps not essential journey, a kind of discretionary journey, and it's difficult to ask other people to go out of their way to do that for them. Much easier to ask it for that bottom level of need, to take people for a healthcare journey, that kind of thing. So I think there's some really important distinctions and things to take into account when we're planning mobility beyond the car, that need to take into account those other elements and those other aspects of need in later life. You'll see that I like developing nice little pretty models. Often I'm really immersed and involved in talking with older people, sharing journeys and experiences with them, and then trying to create a way of displaying that in a nice, simplistic, easy to manage way best we can. One of these more recently, along with Teresa Scott from Australia, was to try and put into account how we develop solutions to mobility that aren't just based on perhaps what we'd normally think, so aren't just based on infrastructure. So, you know, if people give up driving and then they want to go walking or cycling, how do we improve the environment around those people? Well, we can offer better quality pavements, we can offer better places to cross, that kind of thing. That comes under infrastructure capital. Although we don't do that very well, as I'll show in a little bit, I think that's often assumed that's the key element to put our money and our resources in. But actually that's very difficult to achieve if we don't take into account these other elements of mobility. So for example, people support one another's mobility with social capital. Friends and family support each other, and I'll show some examples again of that later on. And that's really vital to, you know, not just to creating community and neighborhood, but supporting one another to get their needs brought together and needs sort of found and kept in line. But surrounding all of that perhaps is cultural capital. So if you don't see older people's mobility as an important element that needs to be resourced, you're lacking perhaps in cultural capital, and that needs to be changed and developed as well. And the nice thing about capital is you can move that all around. So if you've got really good social capital, that can overcome some of the problems with infrastructure capital. So if you haven't got good pavements, haven't got good roads around, if you've got lots of people supporting and helping you walk along the road or getting your mobility needs seen to, that can overcome some of those elements, and vice versa. So there's lots of different ways of sharing the capital around there. And I just wanted to concentrate on infrastructure and social capital moving forward, because infrastructure capital, like I said, is one that's often thought about and discussed, but we're not very good at dealing with it. And social capital is one that's perhaps often forgotten, but can really help and enhance older people's mobility, or not, as the case may be. So walking, particularly infrastructure capital in terms of walking, you know, how do we improve people's walking? What are the barriers to people getting out and about? We know walking is really good for people's health. You know, things like reducing cardiovascular disease by about 30%, all-cause mortality by about 20%, makes a huge difference if people do regular walking on a day-to-day basis. It doesn't have to be, you know, fast walking or, you know, marathon walking, none of your Olympics. It just needs to be, you know, regular and quite small amounts of walking per day. But we're not very good at providing an infrastructure where that can happen. And people talk about an obesogenic environment with fewer and fewer people walking, you know, because the environment is not conducive or helpful to people getting out and about. So walking, despite having all these benefits, has mental health benefits as well, has physical benefits. We don't create a very good environment to do it. Older people themselves tell me all the time how much they enjoy walking. You know, they feel refreshed, that reduces their stress, they get to see things they wouldn't normally see, they can stop and talk to people, have a natter, for example, and explore new places and things like that. It's important to people. One of the most worrying things about walking is just how overrepresented older people are in terms of being injured or in deaths from being a pedestrian, as you can see in the top diagram and in that bottom diagram there. So you see a huge increase, particularly for female pedestrians, from those about 75 years onwards. And then we've tried to model that in the bottom graph in terms of frailty. So you can see that frailty accounts for some of that, but at the same time, it doesn't account for all. You know, they're not, older people are not necessarily more likely to always be a result of injured or killed as a result of the collisions. To some extent that's the case, but it doesn't account for all of it. So there's some sort of big problems with walking in our society that need to be looked at. I think there's some figures that suggest I think older people, perhaps over the age of 70, make up just over 10% of the population, and they account for something like 8% of pedestrian activity, but it is around 44% of all pedestrian fatalities, so those aged over 70. So we really create an environment that is not only very pleasant, it's also quite dangerous. If you have a look at this picture here, this is taken by an ex-PhD student of mine who's just passed her PhD, Dr. Alison Rogers, in her local town. You can see on there some real key problems with being able to walk along that pavement. And again, you know, these are problems and issues for people of any age, but they become more problematic in later life if we've got, you know, things that happen to us all as we age, you know, eyesight challenges, problems with balance and gait, just needing more room to turn around. You know, that environment there, as you can see. I mean, can you identify some things on there that are challenging? You know, just we're not creating environments where we think pedestrian first. So, you know, we've got pavement parking happening on there, elements of that are really narrow, broken pavements and trip hazards all the way along that element, pretty as it is with the, you know, the hanging baskets hanging outside the pub there. I asked in one of my pieces of research up in Greater Manchester to try and get older people to rank the problems with walking in their local areas, and this is the order they came out in. The most problematic was having poor quality pavements, including pavements that just ended and didn't continue. Having poor upkeep of them, you know, you really struggle if, like in those top pictures there, where there's cracks that haven't been replaced or repaired on that. I'm frequently annoyed that I see, for example, the roadway where cars and their £1 million suspension research makes them absolutely smooth as anything, driving along a road that is as smooth as anything, has been replaced, you know, every few years. And you know, I know we have problems with some potholes sometimes, but compare it to what you see on the pavement sometimes, particularly around a tree, where you've got the roots impacting on the pavement, and how much more the roadway is looked after than the pedestrian way. And obstructions on pavements came out just under poor quality pavements, particularly parked cars, but, you know, A-boards, people doing road works on pavements and closing the pavements altogether, meaning people have to go out around these obstructions, making it, you know, really, really dangerous area for people to be. The next area of problem is crossing the road. Older people particularly like having a crossing in a traditional sense, what we might call a pelican crossing, where you see the green man opposite. And the Department for Transport, in its wisdom, has introduced these new ones where you've got the green man to your right hand side of where you press the button to cross the road. And older people who take longer to walk across the road, you know, it can be quite a nerve-wracking experience not seeing the green or red man ahead to let you know, am I still okay to be in this carriageway? Do I need to hurry up? You know, am I causing obstruction? Am I a potential danger? So that's one of the issues. And also a piece of research I did found that, you know, we just don't walk fast enough as we age, compared to what the Department for Transport would like us to walk at. So the Department for Transport suggests the minimum crossing speed is about 1.22 meters per second. I found 89% of people aged over 70 don't walk at that speed when crossing the road. So you're excluding 70% of people, or 70% of people are worrying about crossing that road. That increases to 94% for females, and interestingly, those from a higher socioeconomic background walk faster than those from a lower socioeconomic background, regardless of their health and well-being when crossing the road. So I don't know why that is. Do posh people march across the road more stridently? I'm not sure, but what it does show is that, you know, we've got to think differently about crossings if we're going to cross the road, and take into account that, you know, quite normally, again, we walk slower as we age. And some of these, you know, changes in ourselves as we age happen from a much younger age, and we compensate quite well for them, but they come together in later life and offer more challenges. But they wouldn't be a challenge if we created the right kind of environment for this. Something that Sarah's going to mention a little bit in a minute again is about 20-mile-an-hour zones, because we have a lot of issues with speeding traffic that older people talk about, whether that's speeding in immediate danger because cars are passing quite close and fast, not being able to cross the road because the cars are traveling too fast, or a kind of psychological feeling that the cars are too close to them. Lack of benches and toilets are crucial to being able to walk, so being able to pause and stop, being able to go to the toilet, again, issues for us all, but again, more of an issue perhaps in later life. Even when they do put benches in, they don't do it particularly very well. Look at the one in the middle there. That's in near my hometown of Mumbles on the seafront there, when you've got a nice view of a hedge. I think they've cut that back now, actually, but even the bench isn't very comfortable with those sort of slats across there. And the bench at the bottom in Porthcawl, where they put the benches in the wrong way around, so they don't face the sea, they face the road instead. Porthcawl Council said that they'd actually done it on purpose, that you could have a selfie bench, but I think they were being cheeky there. Poor street lighting, particularly since we've changed to modern street lighting, doesn't light up the whole area. It stops a lot of older people going out and about in the dark, and in the winter times that means being home by sort of 2 or 3 o'clock in many places. You know, quite normal things as we age. Somebody over the age of 75 requires 32 times the brightness they did at the age of 25. You know, we're not compensating for that in our environment by creating a brighter element. And just a note also on pollution that perhaps doesn't come up, you know, it's the 7th most problematic area, but actually probably impacts on people's health greater or as great as some of those other elements on there. You know, but pollution from vehicles remains really high, remains the highest in terms of what you would experience in your own local village or town in terms of pollution. And it can aggravate heart disease, stroke, lung diseases. It can affect bone health and, you know, contribute towards osteoporosis and bone fractures. And it's even the few papers linking it now to risk of dementia as well. So pollution is a key element in terms of health to think of, even if you don't always notice it immediately. But again, it impacts greater on older people who are more likely to notice it, who are less able to compensate for the effects of pollution on the front there. There's a lot that needs to be done in terms of infrastructure. I also like to think of problems with our traffic and transport environment in terms of the social capital that we have. You can see on that picture there, this is where we talk about community severance. So you might recognize that picture there. That's Port Talbot near Swansea. And what you've got there is an example of, you know, a modern road that's car only, going right through the middle of an old community. So you can still connect the community together underneath, but you know, that isn't what happens at the end of the day. So what you get is actual physical intrusion of buildings or roads, cutting communities and neighbourhoods in half, and that reduces the community feel. It reduces the ability for people to support one another's mobility in there, and makes things really difficult to support one another and look after. I mean, there it is being built in Port Talbot. You know, I think it was part of the sort of modernist agenda in the 60s, 70s, 80s. We started building these great big motorways or dual carriageways into the middle of our city centres instead of having them just on the edge. I think in the M4, something like 200 homes were destroyed in Port Talbot, neighbourhoods severed in half, building the motorway right through the middle there. I think it was built sort of mid 1960s to late 1960s. The Western Mail at the time, the local newspaper, talked about it being the road in the sky. It could become one of Wales's greatest sights over the next sort of 10, 15 years. There's this sort of modernist agenda that was what people wanted, that was about moving and people from A to B was really the way forwards. But look, you can literally see there people's communities severed in half as a result of it. It happened all over the country. That's the building of the Westway down into London, and you can actually see on the diagram there how that cuts and severs the communities physically in half. There's the M32 in Bristol, similar element happening. And then these places become non-spaces. They become spaces where people don't want to be part of the community, don't want to walk from A to B across that space. You know, they become places for fly tipping, places for crime, for violence, you know, non-spaces, particularly against spaces for we don't want to be part of them when we age. In some research I did with people living with dementia in their local area, you know, particularly in early stages of dementia, why can't we stay independent and mobile? Lots of people talked about being worried about getting lost, that when they look at the space, there's no defining features to help them orientate their way around. And a lot of that was linked to the way we create these complex and inapproachable road layouts. So, you know, if we're not physically severing the community, we're psychologically severing the community by creating roads that look the same as they do in any other part of the country. So people feel very distracted by vehicles going past, that become overloaded by the noise and the sounds, and therefore not being able to read the buildings in the street and feel like they shouldn't be there as a pedestrian. It doesn't connect to a feeling of place and joining people together. So looking at my hierarchy again, you can see that we're not fulfilling perhaps those We don't fulfill the practical needs very well, but we're certainly not thinking about the social and the aesthetic needs when we're designing our communities like that. There's been some attempts to reclaim it. M32 in Bristol has a market takes place regularly underneath the M32. And it relates back perhaps to some research that was done in the 70s by Donald Appleyard, seminal research that we know about. And really in Donald Appleyard and his colleagues' research, it really shows the psychological intrusion of traffic in an area and how that reduces people's connections to looking after one another or creating neighbourhood and community. He just brought together 3 roads of very similar backgrounds, the only difference being that one had very light traffic, one had moderate traffic on the road, and one had heavy traffic. And he found that those with light traffic, living on a road with light traffic, would know each other better, would look after one another better. On the moderate traffic road, you know, there was fewer friends and acquaintances, so less being a community and neighbourhoodness. And then on the heavy traffic road, even fewer. That was repeated a few years back by a master's student of ours when I was working at University of West of England, Josh Hart, and he did it in Bristol and found just the same kind of thing, and did interviews with people on the different streets. You know, I think the road that had very few traffic on, people knew their neighbours, they looked after each other better. Those on the heavy traffic road down there at the bottom, people don't communicate unless they have to. It's quite anonymous. People didn't know each other particularly very well. And the drawing on there, the lines on there, are people who had connections to one another and knew each other really well. So a big difference. It changes the way people behave, even within their street. Do they make changes because they fear the traffic, they fear the noise, they fear you know, pollution or trash? They change things like closing windows, stopping the kids playing in the street, living more in the back of the house, adding heavy curtains, that kind of thing. Very much so on that heavy traffic street, and somewhat on the medium traffic street as well. But light traffic, much more likely to inhabit the space in their home and outside it as well, moving forwards. And why is that important? Mobility, because social capital helps keep older people connected to their community. If older people are less likely to be mobile and less likely to be hypermobile and move around as much, they're more likely to spend their time in the local community. So we've had examples where older people take in the parcels for the street, and therefore for the people that are working in the street, they come and see them in the evening, and there's that reciprocation of help, if you like. So if the older person needs some help with something, the person comes and visits them, takes the parcel and helps them with things on there. We've had people set up their own taxi service for older people, the grey Uber, people helping with online shopping. And then some research done by another ex-PhD student of mine, Amy Murray, looking at how neighbours gave people lifts or got shopping in for them or helped out and that kind of thing. And that's only going to happen if we allow there to be more neighbourliness and more community. So the reduction of the vehicles in that area contributes to doing that. What do we need to do? We need to think more specifically about how we create age-friendly policy and practice for older people in terms of mobility, prioritising the needs for older people, 20-mile-an-hour zones in residential areas, longer crossing times, places to cross at desire lines, toilet and bench mapping so people know where they are and can lobby for areas that haven't got them, so that we have more benches and toilets throughout. And more, when I've talked to older people, there's quite an appetite for getting more involved in helping support better mobility in the community area. So setting up groups, having community schemes where we ask businesses to open themselves up if you want to take a seat, or if you want to open up the toilets to the public, that kind of thing, without having to pay for, you know, a coffee, opening up the toilets without having to pay for a coffee, for example. And you know, in a very physical way, we've got to move from functional elements, like I said, the bench, the toilets, keeping things well lit and pavements well maintained, having good crossings and safe space from the traffic, to creating also within it all more attractive and more desirable spaces. So we move to more, you know, spaces where you feel that you want to walk and want to be part of, away from traffic, that have something going on, that's something interesting taking place. And really overall what we're talking about, I think, is creating more human spaces where people can interact with one another, can people watch, can see the world go on by and be part of it as they go. And we've created such a hypermobile society and concentrated so much on vehicles that we've lost those human spaces. But that's what a lot of older people talk to me about wanting. You know, if they're going to walk more in their local area that's good for their health and well-being, then they're going to need spaces that are attractive and create some space to stop and dwell and be part of it. And that social capital is really important. Lots of the issues are people-based, so the solutions need to be people-based as well. And for goodness sake, we need to really get rid of that elderly people sign on the left-hand side. Why do we still have that in our built environment? Does it make any difference to the way people drive around those areas? And that sort of stereotypical picture of, I suppose you could argue, it looks like the woman's pickpocketing the man as he's crossing the street, perhaps, but it's just so stereotypical, so old-fashioned, so unnecessary. You know, we're moving away from doing that, and we need to start thinking about the social capital that older people have, the resilience that they have, but also the skills and resources they have, and therefore using that to perhaps help shape and develop our communities and help keep people more mobile and therefore more fit and well as they age. There's some good examples of older people getting involved. Living Streets do good community work and auditing, for example. There's examples in Greater Manchester of local groups taking over and redesigning their local areas. There's the graffiti grannies who started out just by identifying where there was graffiti in their local area, but now are doing bad pavements as well and offering their findings to the local council, that kind of thing. Groups offering training to public transport users to help them get back on the bus, but also the route to the bus, which is, you know, really important, and getting that sorted out. And just offering more involvement in governance, policy and practice, what we might call re-democratizing transport policy and transport planning, and getting older people involved. And just another model, just to finish off with before I conclude, that what we talk about in terms of mobility is often the very literal sense of mobility on that left-hand side. We often think if older people are reducing their mobility, we just need to replace it by a different type of mobility. And of course, that's not necessarily the case. We can think about different types of mobility as well. So we've got to think about how we think, can we create mobility virtual means? Do we need to go shopping all the time, or can the shopping come to us? What happens in terms of health and well-being if we do replace some of those journeys by virtual means? You know, what do we miss out on? Not just perhaps physical mobility, but we miss out perhaps on talking to people we bump into, seeing other people. You know, the journey to the shops is not always just about getting the shopping in. So we've got to think about how we support those if we move to it. And imaginative mobility, how do we move away from literal mobility and think about connecting to mobility without having to be mobile? You know, we've got webcams. I've seen care homes set themselves up with what looks like a train carriage, and you can have the window with things going on. You've got another element happening in care homes at the moment is that people cycling along Google Maps, so they can from a static bike link to a computer, so you can look like you're cycling along, but you don't actually have to go out and about and do that. But what do you lose out on not physically actually being out there? And is there any way of replicating some of that mobility in a more static way? Just before we move on to Sarah, and I see there's some questions, and I'll take those at the end after Sarah's done her presentation, just so I've got time to look at them and digest them. But just to conclude, you know, don't forget, we all want to be mobile. It's really important for health and well-being, but how do we do that and is really crucial, and we need to create the right environment to do that. There's lots of health implications of staying mobile that perhaps are not taken into account in the same way that they should be, and we've got to create a better environment for that to sort of foster that and allow that to happen. We've got to mix transport and health together better, and that's a centre Sarah and I are setting up on the right hand side there, where we're going to look at active travel, look at safety, look at the issues of pollution and community in a new transport group called Transport and Health Integrated Research Network. We've called THINK for short, which hopefully will be launching in the autumn, but of course that'll have close links with CADR, so we can look at how transport and health is affected across the life course. So that's where I end on my little tour of the importance of infrastructure and the importance of sort of social capital in supporting people's health and well-being in transport and mobility as we age. So I'll finish there and hand over to Sarah.
Thanks, Charles. Tough act to follow by any stretch of the imagination there. Okay, so as Charles mentioned, I'm a consultant with Public Health Wales, and I'm with Charles jointly leading the development of Think. I've got a long-standing interest in road traffic injuries mainly, but over recent years have developed a much wider interest in transport and health. Now, I'm not going to pretend that I've got particular expertise in mobility and aging, but what I'm going to hopefully try and do now is go through some of what I believe to be the issues and around transport and the future of transport and how these relate to an aging population. I'll briefly go through some of the background to the last 100 years or so, talk about some of the work I've been doing in relation to the default 20-mile-an-hour speed limit, a little about COVID-19 and what the implications of that have been for transport, and then what I think is the future of transport. So the reality is we're not going to change the fact that we need roads. We've had 12,000 years of roads. The Egyptians were laying roads 12,000 years ago. What's really changed in recent years is cars, of course. Over on the right-hand side of the screen there, the giant blue blob with a tiny strip of red on the top of it. The blue bit is pre-car time. And then the red bit is the proportion of time for which we've had roads, that we've had cars on those roads. It's less than 1% of time. In all the time that we've had roads, we've had many advantages to roads. We've had trade, we've had development, we've had communication, and we've always had disadvantages associated with roads as well. Most clearly and most obviously illness and disease. But it's really over the last 150 years or so, with the development of cars on the roads, that those disadvantages have really been magnified to epidemic proportions. When we first had cars on the road, roads were seen very much as public space. Everyone who used the roadway was seen as having an equal right to use that roadway. And the quote on the left-hand side there was taken from an article written around the same time as the picture was taken. In 1896 in the UK, we saw our first road traffic crash death. The coroner at the time said that such a thing should never happen again at the inquest of Bridget Driscoll. She's the lady highlighted on the left-hand side. And it's difficult to imagine a less insightful comment from anyone. Now in 2021, we're well over 550,000 deaths later. To give you some sort of context with the current situation, COVID is estimated to have killed around 134,000 people in the UK, albeit in 18 months. But we've got a very, very different response to the emergence of COVID compared with the emergence of motor vehicles. In fact, when motor vehicle killings first happened, that was exactly how they were described by the media. Sorry, the cutoff on this slide is not great, but the media used to describe them as motor vehicle killings, and this quite rightly upset people. So there was a reorientation. We started talking about the term accident, and pedestrians in particular were encouraged to stay out of that roadway, the roadway that had once been for everyone. And this was the very beginning of turning the roadway from a place for everyone to a place that was dominated by motor vehicles. Now we are in a situation whereby you can murder someone with a gun, but it's an accident if you hit them with a car. And there's a massive effort going on at the moment as well to reorient the way in which the media in particular describe road traffic crashes, to move away from the idea of an accident. And that doesn't just apply to road traffic crashes, but injuries as a whole. We very, very, very rarely see something that is truly accidental. Inevitably, there is some way we can find that would have prevented something from happening. But of course, the harms associated with road traffic, as Charles has said, go far, far beyond injuries. Injuries are the obvious, the acute, the burden that we all know and talk about on a regular basis. But road traffic also produces air pollution, as Charles has alluded to, increases social isolation and loneliness. And I think this is going to be a particularly important issue in the next 5 years or so. In particular, there are plenty of older people who, because of COVID and because of the issues around shielding and staying away from other people, plenty of older people will not have or been far outside their door in the past 18 months. Their problems with social isolation and loneliness are only going to increase and be exacerbated when they step outside the door now, go back again, and road traffic is increasing rapidly again as restrictions are eased. And I don't like to use the phrase return to some sort of normality, because what we knew was normality is no longer. But we go about business in a way that we did prior to the pandemic again. Road traffic also encourages physical inactivity, as Charles has said. He illustrated beautifully with Appleyard and Lindell's model how little interaction there is between neighbours, and that further extends to them. People feeling comfortable getting out and walking and cycling on the roads. It creates noise, and the health harms associated with noise are thought currently to be equivalent to air pollution in terms of the respiratory and cardiovascular harms that it can produce. And road traffic also exacerbates inequalities. So what are we going to do about it, I think is the pertinent question here. And for me, the key answer, or one of the key answers that we will see emerge over the next couple of years in Wales, is the introduction of the 20 mile an hour default speed limit. Now, whoops, I've lost my slide on the 20 mile an hour default speed limit. Kim, can you help at all, please? I'll carry on talking because that's just a picture of a 20 mile an hour speed limit sign. And while we've got masses of 20 mile an hour speed limit areas, what I can do is, right, we've got masses of 20 mile an hour speed limit areas already in Wales. But our challenge at the moment is that those are limited in their range. And this, of course, then compromises the extent to which they can be effective in both encouraging drivers to slow down and encouraging people to be physically active, to be out walking, cycling, and so on. So it's really, really challenging with the current setup. But in April 2023, we're due to move to 20 being the default speed limit in Wales. And I'm guessing we're still having some tech problems, and I don't think I can share my screen with you. So I'll carry on talking. Anyway, so the next slide.
To share your screen.
Can I share my screen now, Kim?
Yes, yes, you can.
I can. There we go. Okay, I'm going to share my screen. Hopefully, okay. So if I do that, there we go. Yeah. So it's not just me that thinks this. Danny Dorling is Professor of Geography at the University of Oxford, and he's highlighted the potential benefits of 20 miles an hour as one of the cheapest and most effective methods for improving public health today. He highlighted the fact that, in contrast to how many people die by being struck by a car, cars almost certainly kill far more people through the pollution they cause, the exercise they rob us of, and the wars that are fought over the oil to power them. And he referenced this in an approach in a debate about how we could reduce health-related inequalities. And I believe that we will see a benefit of this reduction in health-related inequalities in terms of deprivation, but in terms of also age and sex-related inequalities when 20 is established as a default speed limit. As Charles has already mentioned, older female pedestrians in particular are at increased risk of harm. Now, the evidence for 20 is fascinating from my perspective as a public health consultant. We got good evidence of reduced road traffic injuries. We got good evidence of reduced noise, and there is really, really strong public support for 20. Around 80% of the population actually support the introduction of 20. There's also some evidence that the introduction of 20 improves social cohesion, improves small business viability, encourages physical activity, improves air quality, reduces community severance that Charles already described, and reduces inequalities. But really what's fascinating from my point of view, from a public health point of view, and what's really, really unusual in any area of health is that there's no evidence of harms that go with 20. Now, if we have a look at the data and what current data are available. So this is data for 2017 to 2019 for Wales. The shading hasn't come out particularly well. I do apologise here. So the on the bars, the green and blue on the green and purple on the left-hand side are Wales, and on the right-hand side they're slightly stippled, and they're for Great Britain. And what you can see there, first up here, we've got the driver casualty rates. So they're based on the number of licenses per age group. So that's the denominator, but I haven't been able to adjust for miles driven. So there's probably an overestimation here of the number of licenses in use among older drivers. So what we can see is that there's higher casualty rates amongst younger drivers. That's not really a surprise. But what we also see then is the increasing proportion of drivers who aren't just injured, but they're killed and seriously injured with increasing age. Now, again, Charles already alluded to this, but it therefore suggests that when we increase 20, actually the greatest benefit is likely to be felt by those who are currently at greatest risk. Moving over to pedestrians, and we see a very, very similar pattern. The youngest age groups have the highest rates, but when we look at the proportion of casualties that are killed and seriously injured, this increases with increasing age. And the pedestrians, older pedestrians, particularly women, have greater proportions of deaths and serious injuries as pedestrians, and that in the 70+ year age group, actually we see that this is around 45% of over 70-year-old women who are casualties on our roads are either killed or seriously injured. When we looked at it in terms of deprivation, which we can do for pedestrians only because the challenges with assigning casualties to a geographical place, we can see that just as for many other areas of injury, there is a clear gradient with a greater injury rate amongst those who live in the most deprived areas. Now, generally across all ages, all pedestrians, males have a higher rate of injury than females, except when we look at 60+ year old pedestrians, where women have higher rates of injury, and that clear deprivation gradient still exists. When we look at the ratio of the rate in the most deprived to the least deprived, what we can clearly see is that the inequalities gap is considerably larger for women at all ages, and that as I say, as we reduce the speed limit, because we know that 20 reduces both the risk of crashing and then the risk of serious injury in crashing, then we have the potential to reduce these crashes, casualties and fatalities, and reduce the burden on all age groups, but particularly those who are seeing the greater burden. And at the moment, it is older women. But as I say, it's not just about injuries. And just as Charles has produced some quotes there, I was lucky enough to be on a phone-in programme on Radio Wales some time ago with Dot Davis, and we were talking about 20 miles an hour, and a chap phoned in and he said that actually when the speed limits were reduced to 20 miles an hour outside his house, he felt much more able to get out and about. And that, I think, is really, really critical about the efforts to reduce 20. And I think the efforts to reduce 20 are important now more than ever, particularly in the context of COVID-19 and the world we find ourselves in as we emerge from the pandemic. So when the pandemic started at the beginning of last year, and what you've got over here, this chart starts on the 15th of February last year. All of the vertical reddy pink lines are points that we were locked down or lockdown was released. And you can probably guess what happens at each one without having any great detail, because the way in which travel behaviour changes. And what you see at the very beginning there is those first lockdown points where there was a massive, dramatic decrease in travel behaviours. And what we've seen steadily since that dramatic time is a steadily increasing pattern of travel. Workplace travel is still considerably lower, as is travel for retail and recreation. But people are now travelling to shops for groceries and pharmacies more than they were prior to the pandemic beginning. And this has substantial implications for all of us. And the reasons I believe it's important post-COVID-19, not just 20, but sustainable mobility in particular. It first of all relates to the fact that the NHS, as we are all aware, has spent an enormous amount of time dealing with the COVID-19 pandemic over the last 18 months. This has meant that waiting lists have grown, that planned interventions have been put on hold. And actually, we are therefore, to my mind, beholden over the coming years to actually do everything we can to prevent what is entirely preventable. And this is where I think 20 mile an hour becomes so important, because, as I say, 20 reduces the risk both of crashing and the severity of crashes when they occur. So if we're reducing the severity of crashes, reducing the number of crashes, then we're reducing the number of people who are requiring treatment in hospital, freeing up space for people who do need treatment. We are also then able to encourage people to get out walking and to experience the benefits of physical activity, to cycle, and therefore experience the benefits of cycling, of physical activity, but also to see friends, family, and to reduce their loneliness, feelings of loneliness and isolation. Again, things that can help us feel healthier and improve our well-being. We know that home working has become very much the norm for a large proportion of the population now. And with this has come increases in active travel. Maintaining these, not just because the benefits in terms of supporting the NHS, but in terms of encouraging sustainable travel and also combating the effects of climate change, are really, really critical. So we need to look at how we maintain these. But we also know that on the other side of this, confidence of people in using public transport has decreased substantially. Very, very few people are using public transport. Yet there's no evidence that the COVID-19 has actually spread on public transport. The flip side of this is a concern that people will retreat to their cars. Now, we know that there are some journeys, that there are some people in some places that aren't accessible by public transport, but we need to do plenty to really rebuild trust in public transport, to maybe reorient the way public transport's delivered, so that the Charles model there of the reasons why we travel can be better adhered to by a public transport system that has really in recent years focused on commuters, when actually there's an awful lot of leisure travellers out there who would like to use public transport, but maybe are put off by costs or by the numbers of commuters that are on those vehicles. So we've also got pictures of wildfires, and we've got the COP26 conference being held in Glasgow later this year, which is talking about the need to significantly decrease the number of journeys that are made by car and to increase our journeys made by walking and by cycling. And as I say, I think what we've really got to look at here is those shorter journeys, those 1 to 3 mile journeys that are doable by other means than by car, and that will really make a difference to the way in which we travel and the way in which we feel in terms of health and well-being. which I suppose really brings me on neatly to the future of transport. Now, the Welsh Government is very, very committed in its latest Welsh Transport Strategy to adopting the sustainable transport hierarchy, one in which walking and cycling are prioritised ahead of private vehicle and air transport down at the bottom of the chart there. And this is very much what the WHO is promoting as the way in which we can combat the effects of climate change as well. But it's not just about providing walking spaces and cycling spaces, it's about doing so in a really inclusive manner. And this is why I particularly like this diagram, because while a certain amount of it is stereotypical, I think it goes some way to emphasising that there is a bike for everyone, even though not everyone has ever learned to ride a two-wheeler, that there needs to be a walking space that is accessible to everyone, not like some of those spaces that Charles has shown there. And it really emphasises the need to make places suitable for everyone. There are many, many benefits to doing this. As Charles already alluded to, we've got roads that are beautifully smooth surfaces, yet pavements that are like, well, they don't bear thinking about. I've spent too much time in my life on crutches, and I wouldn't pretend to know how people who deal with these situations on a daily basis throughout years of lifetime, but just a few months here and there on crutches is not a pleasant experience. We need to do masses to make it much easier for people to walk and cycle, yet our investment currently is balanced in favour of roadways. However, the reality is that at the moment, much of our government subsidy goes towards cars and roadways. This is a slide from the graphic is taken from US data. So you've got dollars and the values are US dollars. But sorry, my front door's gone. I do apologise. Do apologise. So what you've got here is that society is paying masses for people to drive in terms of vehicle subsidies, fuel subsidies, and paying for roads. But actually, if we encourage more people to walk and cycle, actually society is saving money, both in terms of the infrastructure that's needed and in terms of the health benefits for the people who are walking and cycling. So in some recent analysis or some recent data collection, this is through Healthwise Wales, we've asked people what would encourage you to walk or cycle more often. These are from a sample of 5,500 responses. These are the free text comments. One lady mentioned the fact that it would take over 2 hours to travel the 35-minute car journey to work by public transport. Something like that is never going to encourage people out of their cars. Someone else suggested government-funded three-wheeled bikes. As I say, there's a bike for everyone. We've just not gotten used to going looking for them. There's a need for better cycle parking facilities at shops and a variety of other destinations. More general comments included that when people considered the barriers to walking and cycling, a number of people mentioned that arthritis, ill health, being immobile, disabled, too old or too unfit, actually made it impossible for them to walk or cycle. And I have to confess, I found this incredibly disappointing, because there is plenty that we can do and should be doing to combat those notions that actually those health effects would be harmed by walking or cycling, when we know that the reality is that gentle walking, cycling if you're up to it, is a health benefit for the vast majority of people. There are no negative effects of going out for a walk, unless we look at the obvious injuries. So we need to do everything that we can to combat these notions that people have, that that they can be harmed, their health can be harmed by doing these things. Others talked about whether the hills and rural locations, which I think would be challenging for any of us to deal with. But there's a variety of other issues there that actually we can look at. Charles has alluded to pavement parking. But the lack of availability of bikes and the cost of electric bikes I find fascinating as well, because we've always, many of us are familiar with the notion of a company car, yet few of us would ever have been able to get hold of a company bike, and few of us would ever be able to obtain a season ticket for travelling to work by train, and yet a company car would be seen very much as the norm and a perk in in some industries. Critically down there as well, we've got the lack of either the lack of infrastructure or shared infrastructure, as someone's alluded to in the questions, and the issues of lighting and safety for women. Some chap called Charles Musselwhite has recently commented as well on the need to normalise cycling. The video that went with this article was staggering. It was one of those in which the pavement just disappeared. And the issue is active travel just isn't taken seriously enough. When we look at the plans for road building and the money that's going to be spent on road building, compare that with the money that's being put aside for building pavements and cycleways, the disparity is staggering. Now, you may have seen the next slide already. And the reality is that electric cars certainly aren't going to provide any answers. In fact, they've got all of the disbenefits that a standard current petrol diesel car has, and a few more negatives as well. There is, in theory, an electric car will improve air quality marginally in terms of NO2, nitrogen dioxide, but actually, because of their greater weight, will probably produce more particulate matter than an equivalent petrol or diesel vehicle. So actually, electric vehicles probably aren't going to do a great deal for us, except clutter up the pavements in a way that's going to hinder everybody's ability to move safely around the transport network. And similarly for autonomous vehicles, they're probably they've really got no more benefits than petrol or diesel vehicles. And I think I've heard or read a lot in the media that actually autonomous vehicles are going to revolutionize the world, particularly for older people, because they'll just be able to summon an autonomous vehicle that'll pick them up and take them into town, and they won't have to worry about anything. But actually, if we look at the risks that certain pedestrian groups are the risk to certain pedestrian groups that are associated with autonomous vehicles not detecting them, I think particularly older and younger people are likely to be at greatest risk. In fact, I was in a discussion with Charles and a couple of colleagues earlier in the week, and we were very much the opinion that actually no autonomous vehicles will never happen. It just doesn't seem possible. Especially when I think Charles was having problems putting money back into a cash point at the time, which was what set us off on the discussion. But the future can't be autonomous vehicles, just as it can't be electric cars. We can't just swap car for car, because there just isn't the capability on the planet to do so. So the future of transport, well, it's not autonomous or electric vehicles, in my opinion, and I think far more eminent scholars than I am. I'm just an amateur having a chat with you one lunchtime here. Will tell you in far more detail why. Hyperloops and billionaires in space. Well, if we leave the billionaires in space, maybe. But we definitely do need to be looking at the sustainable transport hierarchy and how we make that more available and accessible to people of all ages. I think electric bikes have really got masses of potential. Walking and cycling infrastructure is also essential, particularly if we can split it into space for walkers and spaces for cyclists. Public transport really does need. We've got the opportunity post-COVID to rethink how we deliver public transport, and I think it's a massive opportunity rather than a challenge. So to paraphrase badly Mangle and acknowledge Hillary Clinton, and like her or loathe her, yeah, okay, she got bad choice in men, but most of us have, I think. Transport in later life, I think, was my conclusion when I thought about this presentation. If we get it right for later life, then it is actually, the reality is that it's transport for all of life and everyone who lives in it. Thanks for listening, and apologies for the disappearance in the middle. Thank you all.
Great, thank you, Sarah. If you stop sharing your screen, we'll take a couple of questions that have come in. Let's see if I can, how do I highlight both of us somehow? I can't see you, Sarah. I don't know if everyone else can see. Have you turned your camera off? Or is it my hopeless, useless way of looking after technology, like you said the other day when I tried to pay in some money into a cash point and totally
Sorry,
failed
Charles,
to do
couldn't
it.
resist that.
That's all right. That's all right. It was, yeah. I mean, it's an eye opener just to how far. You know, I think I was paying in £20 notes, and one of the £20 notes was slightly creased, and it sent the whole thing into a spiral of doom and turned the machine off and caused the workers to have to walk around the back and sort it out. And you're right. I think we're a long way off, therefore, thinking about autonomous vehicles. I think, like we discussed before, the only way autonomous vehicles might work would be if they were on their own dedicated infrastructure behind some gates where, you know, you hardly ever share it with any other form of mobility, a bit like we already have with trains and railways. So, yeah, perhaps a long way off for now. We've got a couple of questions from Catherine and Daisy. So thanks for that, about walking next to cycling being challenging. And I think I have some sympathy for that, but I don't think I'd blame the cyclists. Again, it's the fact that the infrastructure throws the cyclists and walkers right next to each other in a small, narrow band of space, while the cars get loads of room over on the other side. Yet, you know, you could move far more many cyclists and walkers through that same space if it was as big as the road was, for example, without even coming close to each other. But so again, it's just a lack of imagination again about, well, there's some active travellers, let's throw them all together, regardless of their age or background, or whether some of those cyclists want to go at 40 miles an hour or some want to go at 15. We'll put them all in the same space together. Yeah, and I think, Sarah, you might have more detail on the actual stats because you're a bit more you know, knowing about these things than I am, but I don't think there's very many, you know, injury or certainly very many deaths at all, is there, between pedestrians and cyclists, especially when compared to pedestrians and cars?
No, there's not. And I do find it staggering that the media, when they do occur, the media makes a huge splash of them. We get invariably there's a massive outrage that a conflict has occurred between a cyclist and a pedestrian, which resulted in a pedestrian injury or fatality. And I agree wholeheartedly with that. But we don't do the same when a car has hit them. And I've just done it myself now.
Yeah.
We don't get anywhere close to referencing the driver who was driving the car, because of course cars aren't autonomous. There is someone driving that car who has hit the pedestrian, and yet we don't show the same outrage. And I think the other point, Charles, just to build on what you said there, we've been in a world for the past 18 months where pedestrians have needed a lot more space than they did previously, just because we have wanted to encourage people to social distance. And have you seen the outrage that we've had from the drivers who were protected in their bubbles about having any of their space taken away from them? It's been staggering, and I do think there's a lot of work to be done with the media, because the media does love a poor driver story, and I think they like nothing better than to say, oh look, it's a war on the driver. But I think we've all got a responsibility, because most of us, I'll hold my hands up, I'm a driver. I do quite like my car, but I love a train. I love my bike, and I love being out for a walk as well. And I'd love to be able to do all of those things more readily. I'd love to have been able to. Sorry, I'm going to go off on a ramble. I went to visit a friend in the northeast of England last weekend, and my daughter and I, it would have cost us £520 return to go by train. So we ended up driving, and yet it would have been far more pleasurable to have gone by train.
And
just go on.
Yeah, I was just going to say that's a financial competition there of what made you choose which mode to go by. And interestingly, Kim and Catherine have put on the chat there, you know, that they don't want to cycle because they feel it's really dangerous. So that's a financial issue you did there. But actually, loads of people don't cycle because their competition is cars driving far too close to them or dangerously to them, or you know, bigger vehicles than that. And having dedicated infrastructure again really helps, you know, especially those who don't cycle quite so often, or get you into the mood for cycling. When you're a bit more confident, the road is perhaps easier to deal with, but still not great. But it just shows, I think that's what working with older people on transport has really taught me, is that competition between different modes, and how walking and cycling, the active travel, which is good for your health and well-being, is always at the bottom. It's hard to do because of the other modes, if you like, impeding on them and being supported.
It is. I'm lucky. I live in Cardiff near the Taff Trail, so for me I can go out on some fantastic cycles from here. My daughter's school is about 3 miles away, and as much as I would love us to be able to cycle to school, there is a hideous bit of road we would have to cross. She's only 7, and to the thought of trying to cross that bit of road, there's no crossing there, of course. There's no the thought of us trying to cross that bit of road with 2 bikes and 2 sets of bags is beyond me. Now, my mum, who was at the door, regularly crosses that bit of road. Mum loves being out walking, and it gives me the heebie-jeebies every time I think of my mum crossing that bit of road, because unless you're Usain Bolt, it is a terrible, terrible bit of road. And yet, if you know where it is in the grand geography of Cardiff, it is the most logical place for a crossing, because it would make so much of so many parts of the city accessible to so many more people.
And I know we've concentrated quite a bit on walking and a little bit on cycling in this sort of conversation today, but of course it does affect other modes of transport as well, because every journey begins with walking of some kind or other. So, you know, and when I mean walking, I mean, you know, that might be in a mobility scooter or in a wheelchair as well, or with mobility aids of some kind or other. But, you know, you've got to move from one place to another somehow in order to get on a bus or to, and again, that has, you know, there's a lot of research that says that has protective health benefits as well. So stops people being obese and stops people developing diabetes. So similar kind of thing, just because there's a walk at either end of the bus stop. So you know, supporting these things. And it's a bit like Sarah, I'm not totally anti-car. I quite enjoy driving, and it has huge benefits, like I started the conversation with, you know, to society as a whole, and we all benefit from that, even if we're non-drivers. But at the end of the day, we've let them grow out of disproportion, really, and go off all sorts of tangents and support them everywhere without you know, thinking of what the side effects are, particularly what we're talking about today, the side effects for our health and well-being.
I think so. I think you're right. I think it's about getting the car back in proportion. I don't for 1 minute think that we're going to have roads that are car free. I don't for 1 minute imagine that. We just need that bit of proportion, that, as you say, when you've got all things considered, Charles, it's easy to make a decision based on the best mode of transport for you and the journey that you've got ahead of you. And that it isn't one of, actually, I have to take the car because it is just too expensive to go by train, or I have to take the car because it is just too dangerous to cycle. But it is actually, right, well, I can leave the car there because it's as quick for me to cycle, and it's as safe. Well, it's arguably safer. I told Charles the story of being on a train a couple of weeks ago, where there was a large number of sort of 20 to 30 something males on the train, none of them wearing masks. And I was weighing up the risks of them being maskless and having COVID versus them being on the roads and driving. And I decided I was far safer being on the train with them. But it's all of us having an environment in which we can make the right decisions for us at the right moment.
Absolutely, and it excludes, you know, thinking of what Daisy and Catherine were saying in the chat as well about, you know, Daisy, I'm sorry to hear about your father with dementia, you know, ending up in hospital, falling on a pavement. I mean, that's horrible, because again, these decisions to support certain modes over others means that people who are, you know, traditionally excluded in things are even more excluded. So if you've got any cognitive challenges, if you've got any, you know, physiological issues that make, you know, walking difficult enough as it is, we're not supporting them at all in the built environment. So you're probably right, Daisy. I don't have figures to hand, but I think people with dementia are much more, well, I know they're much more likely to be overrepresented in falls. And I guess that would be on pavements if they were going out and about. But I guess, you know, in my research, I hear people, you know, either going a long way around so that they can walk safely to somewhere and go on a crossing they feel safe with, or take roads where there's pavements or away from vehicles, or not going out at all, or going out very rarely. So people are really, you know, worried about going out and about. So you know, I don't have the exact figures, but I guess you would find overrepresentation of people living with dementia.
I think you would, and by my understanding as well, Charles, wouldn't that also, and I could be very wrong, but would also exacerbate the symptoms of dementia as well, because then there is a lack of stimulation and a lack of interaction with other people that then continues to exacerbate the illness.
Exactly. Yeah.
To know, I think Kim has put in the chat a question about cycle lessons. Now I know in Cardiff, then there is something called Pedal Power, and they offer cycle lessons, but they also offer cycling for everyone, basically. So if you want to be on a bike, they have a bike that you can be on, and I'm not sure if Pedal Power operates outside Cardiff, but I also know someone that I used to work with, her husband used to offer cycle lessons in Swansea. So I think there are plenty of cycle lessons around for adults as well as children, but I think it's finding those, and I think maybe that's something we've all got to make sure that we talk about more, is how people can access, there we go, bikeability in Calais, how people can access lessons, training and education.
Social support again, isn't it?
Exactly.
Yeah, some of the older people I talk to worried about what happens if their bike gets a puncture and things like that. When they were young, they'd turn it upside down and fix it there and then, or be able to wheel it home, or, you know, what do you do if you're don't feel you can do that kind of thing? But again, some of the education and training you get around that will help support that, you know, help you say, actually, it's easier than you think. Oh, call this number and I'll come out and help you, especially people like bikeability and things. And
exactly, and I think there are plenty of services like that. But then there's also, just as we've managed for a car, there's all sorts of tires now on bikes that don't get flat, or that there's a tube of gunk that'll get you home. But we've because cycling is now so unfamiliar to so many of us, that those obvious fixes that do exist just have been forgotten, haven't they?
Yeah, that's a really good point. I mean, you think how difficult it is to change a tyre on a car, yet there's loads of solutions for that. We don't worry about that when you're out and about. You'll be able to get your way home some way or another. But cycling doesn't have, or at least people don't know what the solutions might be to that. And that becomes a barrier to taking it up. Yeah, exactly. Right, if there aren't any more questions, perhaps we can finish there. Shall we, Sarah? Do you want any last words? Or
I think I've said enough, Charles.
I think we both have. But thank you all for listening to us going on our high horse or high bike or high walking. It was really nice to be able to discuss those points and bring them across to you all. And thanks for your questions and interaction. And if there's anything comes up afterwards, don't hesitate to contact us again. So that's it for our seminar this lunchtime. We've got some seminars coming up for you next, which are being put put on along with Social Care Wales Improvement Cymru and others about developing evidence-enriched practice. So anybody who knows Nick Andrews and his team are putting on a series of 3 workshops towards the end of September, I believe, which is all about supporting or improving, I suppose, care homes for people working with people living with dementia. So anyone can get involved in those. Again, I think they'll be free, but if you've got an interest in that area, do get involved. Have a look on our website and sign up for those. But other than that, thanks to everybody for being part of it, and don't forget to fill in the evaluation forms for us. I think one might pop up when we end this, but if you can't do it there and then, I think one will be sent out as an email later on as well. But let us know how it went. But thank you very much for all of your time, and see you soon.